Hi everyone, my name's Amanda Harris and I'm the owner of Re-Kinect, and I am here at WellcomeMD in Richmond today with one of Welcome's great Richmond physicians, Dr. Mary Colfer, and she's going to talk to us a little bit about sleep. And Dr. Colfer, you and I were just chatting a few minutes ago about fatigue being one of the #1 symptoms that people bring you when they come to see you. Tell me a little more about that.
Yes, so fatigue is definitely one of those things that people come in with that I feel like traditional medicine doesn't always address that well. And many times patients are fatigued because of a lack of sleep. And so that seems really obvious, but many times we don't make that connection. So whenever they have that, we go into a deeper dive about what sleep looks like for them, if they're having trouble falling asleep, if they're having trouble with waking up too early and not being able to fall back to sleep. So we address that issue. And the reason is because sleep is important not just for preventing fatigue, but it's also important for maintaining a healthy weight, and then also for our immune health. Our body's immune system really rejuvenates when we're sleeping, and that allows us to not just fight infection, but also to fight things like cancer, which is important for the immune system.
Huge. Yes.
So,
and then there's a connection with weight, you said. A lot of us don't think about weight and sleep.
Exactly. So there are some different theories about this. For one thing, if we're sleeping, we can't be eating.
That's
so
true.
that's the most obvious, but it is more than just calories in and calories out. Some of the hormones that help control appetite and metabolism are created by our brain while we're sleeping. So that becomes really important part of that, of maintaining a healthy weight.
So it's true when they say the body is really recovering from life when you sleep, right?
Absolutely.
It becomes terribly important.
Yeah, and we even make our neurotransmitters while we're sleeping. So, you know, if you've ever been sleep deprived for either from being a new parent or other reasons, you'll notice that you become more emotionally fragile, but that's a part of it, is that that's when we make our neurotransmitters. So it's hard to be our best selves when we're not getting enough rest.
Right.
So,
and then you mentioned when we were chatting earlier this concept of sleep hygiene, which I found fascinating, and that could probably be at the root of that for some of us, right?
Absolutely. So, especially in our modern lives, so sleep hygiene is just this concept of getting the ideal environment for sleep. And so the most obvious things are having a comfortable mattress, having the temperature correct, which really an ideal sleep temperature is 68 degrees or lower, but also watching the electronics interferes with how our brain produces melatonin. So we really need to shut down the electronics and the TV an hour before bed. Some people have a really hard time changing that habit. So an alternative, if you can't get rid of it, is a lot of devices have the ability to switch it to a nighttime mode, which cuts down on the blue light, or you can actually get glasses from Amazon that block blue light.
Wow, I've never heard of that before. That's
so if
terrific.
you're reading on a tablet and that's kind of your nighttime routine, it's a good idea to do that, especially if you're having some early morning waking. It may be that your melatonin's not lasting long enough, and so that will help with that. And a lot of times people don't even realize that their device has a setting for it as well. So,
oh wow,
yeah. And then another thing that we sometimes don't think about is caffeine after a certain time in the day. Alcohol can actually interfere with sleep cycles. It usually makes us tired, so it might make it easier to fall asleep, but then it can interfere with the rest of the night, so there can be early waking, insomnia. And then exercise.
Yes.
Exercise in general helps us sleep, but if we exercise too close to bedtime, it can keep us awake.
Sure, it's kind of like a stimulant in that way, isn't it?
Yes.
Okay, well that makes sense.
Yeah.
So then if we go, after our environment, we really try to clean it up. We take the electronics out of our bedrooms and we, try to get the temperature just right, and we exercise at the right time of day, and we don't drink alcohol or caffeine at night, and we do all of this right, and we're still struggling to go to sleep. What do you do then?
So typically in medicine, this is when we would prescribe something to help you sleep.
Okay.
And sometimes that is necessary, but we do need to realize that most prescription and most over-the-counter sleep aids can interfere with normal sleep cycles. So we typically would need to be getting deep sleep, REM sleep, which is that dream time, and light sleep in a specific cycle through the night. And all of these medications have a tendency to interfere with that. And trazodone is one of the older prescription sleep aids that doesn't interfere as much, so that's an option. But even Benadryl, which is over the counter, can interfere with it.
Wow, so like Benadryl and the, what is it, the Z-Quil and all those things that you hear about that you're supposed to be able to fall asleep quickly, those help you fall asleep, but they don't necessarily help you build healthy sleep cycles, is what you're saying.
And they may not help with the symptom of fatigue because you may not really be getting the sleep cycles that you need, the deep sleep that's really restorative.
Right.
Yes. So a lot of people will say, I think you had mentioned your husband has this, that Benadryl hangover.
Yes.
So that is really because even though it got you sleeping, it really wasn't that restorative sleep.
Right.
So yes, so there are some other over-the-counter things that you can try, things like melatonin, magnesium, and something called L-theanine, which is an amino acid from green tea. These are all supplements that tend to help us sleep better without interfering with the sleep cycle. Obviously, it's best if you're taking those things that you have a doctor following to make sure that they're safe for you and they can be used with your other medications. Oh,
so, definitely.
Yes.
And then you also mentioned meditation and mindfulness. I thought those were really terrific sleep aids. I mean, not really sleep aids, but I mean, very helpful. So tell us a little bit about how you use those.
Yes, so one of the things that can wake us up and then make it difficult to fall back asleep is a high cortisol level, which comes from stress.
Yes.
And in our kind of 24/7 environment that we all live in, that's just go, 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 most of us have elevated cortisol levels, even if we haven't had anything traumatic happen to us. And so mindfulness or meditation, even practice just 10 minutes a day, can help lower cortisol levels, and that can help us sleep through the night better. And also with that, if you're having trouble falling asleep, if you've already gotten into the habit of a mindfulness routine, you can sometimes use those skills to help you with falling asleep. Ideally, when we're practicing mindfulness, we're awake through the whole thing, so we get all the benefits of it. But then it can become a tool to help us at other times. So
terrific, and manage stress to boot, right?
Exactly.
Excellent. Well, thank you for your time today. And if you haven't heard of WellcomeMD before, it is a great holistic and integrative health practice here in Richmond, Virginia. Dr. Colfer and her colleague, Dr. Carl, are great resources, so please check them out. And if you want more information, you would just log on to
WellcomeMD.com, and welcome is with 2 L's.
Yes. Welcome, right?
Yes, exactly.
Okay, great.
Thank you, Amanda.
Thank you, Dr. Colfer.